Good to have you back. This is the South African Morning. Now, the cost of COVID-19 tests in the private sector has been reduced from 850 Rand to 500 Rand. And this follows a complaint lodged in October about the exorbitant prices. So let's get some more on this with public health lawyer Safura Abdool. Karim, Safura, thank you for your time and good morning to you. I think my first question to you is about your personal opinion on, the reduction. Do you think it's enough? Do you think it's adequate? Or could it went much more lower than it is right now?
So I think what we have to understand is that the settlement is a compromise. This was in lieu of the Competition Commission actually investigating and making adverse finding against these two labs. There was this agreement to reduce the prices. That is not reflective of how much lab tests actually cost. And there's no doubt in my mind that the price of lab tests could have been reduced further. And what we would hope to see over the next few months is a reduction of those prices gradually as there begins to be more and more competition around the lower prices. All the labs are sort of holding the line at about 850 Rand. Now that the prices have been reduced, we're going to see smaller labs also trying to be competitive and reducing their prices.
Absolutely. And I know the Competition Commission has been quoted as saying they had the best interests of the consumers at heart because of this amount. I mean, surely it means that most South Africans were not affording the 850 Rand.
Of course, while we do have free testing in the public healthcare sector, that is not enough. And often what people need, if they're going to travel, if they're going to certain venues, or if they're needing to get operations, they may need a private PCR test. They may need that really rapid turnaround. And the private sector has a lot more lab capacity. So really, this is very important. It means that people are getting more and more access to tests, which is absolutely critical. As we're approaching the fourth wave, people need to be able to test. They need to know when they need to isolate and quarantine so that they don't spread the virus further. So really the timing of this couldn't be better.
Let's talk about then the Competition Commission and what sort of information they have at their disposal. I understand that between September and October the Competition Commission was alerted that of course of the pricing abuses after private pathology labs experienced quite substantial cost reductions and with us processing significant volumes. However, they still continued then, Safura, to charge the same amount to consumers. I understand that's part of the reason why that engagement was important for the Competition Commission because of some of these findings.
So I will say that there has been an attempt to reduce the price of these tests since dating back all the way to June last year. And the Department of Trade and Industry actually issued a directive that would have allowed the labs to negotiate and quote unquote collude, which is normally not permitted, to try and bring the test down. So the government has been trying to get the labs to reduce the cost of these tests for over a year now. Of course, it's particularly apparent when you see the reductions in cost, not only internationally, but also when we start producing many of the components of the test locally, there isn't really a reason for it to be so high. Of course, the NHLS, which is one of the biggest public labs around, also provides a benchmark of how much these tests should be costing. We know that even at 500 Rand, these labs are still making quite a substantial profit off these tests.
Yeah, and with that being said, just briefly before I let you go, any likelihood whatsoever that they might be cheaper than 500, they might go lower than the amount we're seeing right now, 500 Rand?
I really hope so. And I think, in 6 months' time, if the labs haven't reduced the cost themselves, we're going to be seeing the Competition Commission in very much the same position again, because the price of these tests should be going down and down as time goes. It shouldn't be staying the same. So, either by force or willingly and voluntarily, the cost of these tests are likely down. But I would encourage people to go and get tested now, not wait for that, because that'll be months in the future.
Right. Well, I appreciate you speaking to us and coming on to the South African Morning. Public health lawyer Safura Abdool.